Welcome to the Power of Peacefulness podcast. Your host, Dr. Sharon McLaughlin, board-certified plastic surgeon that also has an autoimmune disease. I realized how much stress was taking a toll on me with my marriage, with me being a mother, with my professional life. This podcast is all about bringing peace into your life and stress relief. Each week, we'll have different guest speakers who are bringing peace into their life. If you want to do a little exercise, I have a free workbook. You can download it today at Sharon McLaughlin, MD /workbook. It has some journal prompts in it, and you can start answering those questions today that will help bring peace into your lives. Let's get started. Hey, everybody. Today we have Dr. Kara Wada with us. She is an immune health expert, a physician herself, an allergist, who then became a patient with an autoimmune disease. Dr. Kara Wada, I know that you are out there, you're helping others with autoimmune health. I myself, I have a form of ulcerative colitis, and this podcast is all about peacefulness. So when I think about peacefulness, I think about stress and I think about health. And we know that autoimmune disease has a lot to do with stress. You're practicing. How did this come about?
Yeah, so I was about a year or two into, my first big girl job as an attending physician. I had just come back from maternity leave with my second little baby. She was about 9 months old. And I just felt exhausted from the time I woke up until the time I went to bed. And, really, I thought it was just part of being a doctor mom, of being an attending, having a busy schedule. I work at a big academic center, seeing all sorts of patients. And I went to my dental checkup, and the dental hygienist said, Carol, your mouth looks dry. And it was, such a seemingly benign comment, but it really was that final puzzle piece that really brought, this constellation of symptoms that I had been dealing with in hindsight off and on since college, really into a different perspective of like, oh gosh, I need to get that checked out. And in my mind, what I was worried about at the time was Sjogren's. Something I'd learned about that connection between, in particular, dry eyes, which I had been dealing with. I couldn't wear mascara. I couldn't wear my contacts for a few years, and the dry mouth. And then I had some back stiffness that always got better when I was pregnant. And that seemed weird because all my girlfriends were complaining about their back, when they were, the later stages of pregnancy. And so I, made that appointment with my primary care doc. I knew what labs to ask for, met a little resistance, but ended up, that was kind of then the diagnosis. What I now know, I was fortunate in many ways to have lab results that confirmed my suspicion. For maybe somewhere of 30 to 40% of folks with Sjogren's, their labs are normal. And so, it's been a new education in learning how to navigate life better with a chronic condition. And I've learned so much from my fellow Sjogis community in how to take care of myself, but also to better identify this condition in my patients as well.
Tell us more about the condition for those who are out there that don't understand or have never even heard of Sjogren's syndrome. Can you tell us a little about it?
Yeah. So for many years, it's been called Sjogren's syndrome, and that nomenclature has changed in recent years to Sjogren's disease, knowing that there is an etiology behind it. Some of the other things that we've learned maybe in medical school is that it can be primary or secondary. That doesn't matter anymore. It's an autoimmune condition, meaning our body is failing to tolerate elements of ourselves. And it is, still characterized in many patients by the tissue dryness, but really the central issue is really focused on autoimmune destruction of those moisture-producing glands, and also impacts our autonomic nervous system. So it's actually the number one autoimmune cause of dysautonomias, or these problems like POTS, where our heart rates and our blood pressure are doing funny things. Maybe we aren't sweating like we used to be able to, or our digestion is not moving along as it's supposed to as well. And fatigue is really the main thing. Fatigue and body pain are the main things that patients will complain about. They're not coming in to clinic complaining about their dry eyes or their dry mouth. it's just, that's, it may be there, but that's, small potatoes compared to the fatigue and the body pain, which are really impacting their ability to go through life.
All right. Tell us about stress and autoimmune disease. Autoimmune is more common in women, right? Well, off the top of my head, I think 75% more, right? Compared to 75% of the cases are women compared to men. And then tell us about how stress can affect or play into autoimmune diseases.
Yeah. So it can play into from the very inception of our immune systems going haywire, misbehaving, as I like to describe it. So we think about, our overarching ideas and concepts of why are we seeing so many patients with autoimmune disease and allergy? It's a breakdown in our barriers. So our gut, our airway, our skin. And when those barriers have chinks in our armor, our immune system is then able to see elements of our immune system it wasn't able to see previously. Stress plays a role in the breakdown of those barriers. So if you think about a chronic stress response where you have increased levels of cortisol or adrenaline, aka epinephrine, coursing through our body day in and day out, whether it's due to, actual stressors or perceived stressors, it doesn't matter. All those are viewed the same by the body. That really then impairs our ability to keep those barriers tight and keep things in a setting. We also know that there is an association between trauma and stressors in childhood, so adverse childhood events, and subsequent diagnosis with autoimmune conditions. So the higher your ACE score, these are things that include maybe a parent with substance abuse issues or run-ins with the legal system, physical, sexual, emotional abuse, all of those things play a role in altering how our body perceives the environment and can kind of turn up that set point where we're always in that fight or flight kind of setting. And then, when we look at, even some of the more granular data. So I practice at The Ohio State University, and Dr. Glacier and Dr. Glacier, the married couple, many years ago did some of these pivotal studies here looking at how stressed medical students had an impaired immune response. So we also know that those stress responses also impair our ability to fight off infections, to mount a response to our vaccines. So, it's at multiple levels that stress is impacting our immune system and setting the stage for things to go haywire.
Tell us about your own personal experience as far as becoming an allergist. Why did you choose this? Because this was even before the autoimmune disease. I've
always been fascinated by, one, taking care of patients across the lifespan. It's one of the few specialties where we can see folks from, itty bitty babies all the way, to their golden years. So that was one area that I really liked. I loved also the science. So understanding how there was cause and effect in these really immense webs of our cytokines and our cells, and how something so simple going wrong, like a little genetic mutation or an infection with a particular, gram-negative bacteria, could really turn that system into chaos. I thought was absolutely fascinating.
You mentioned cortisol before. It is trending on Google. It's trending on TikTok. We have to speak about cortisol. Tell me what are the factors, like I think about sleep, I think about good nutrition, I think about personal relationships, fighting and that stress. What are some ways that people can lower their cortisol level or work with decreasing stress that may not be as common, like that come to our thoughts?
Yeah, I go back. So I've done some training in lifestyle medicine. So I love this idea of being able to harness healing from our habits. And as humans, we have, this lizard brain, which is oftentimes what triggers that cortisol response, the monkey brain and the human brain on top. And so, using our most human aspects to help our health is paramount. So I think planning ahead when we can, especially as it comes to nutrition, can be really helpful. Instead of waiting till we get hungry and then just eating all those things that make us feel good in the moment, but aren't better for our future selves. So, to drive home the point, nutrition is key. Movement, we're made to move. And especially for those of us who have chronic pain or chronic inflammation, some is better than none. And finding something that provides you joy and generally feels pretty good is a great way to start. Sleep is like, for me, I've realized in my own condition, sleep is a non-negotiable. I need that 8, sometimes even 9 hours if I'm fighting off a little cold like I am right now, in order to allow my body that time to rest and digest. I've also realized that, and this is true of folks who have dysautonomia, that we are lighter sleepers overall. I saw that transition to being a lighter sleeper when I became a mom. We know that also can alter our sleep patterns. But I've gotten like a little sleep mask that's helpful, especially as I get into summertime and it's a little brighter. And then some white noise can be helpful to keeping the room cool. And the other part that I think has really moved the dial, more than anything, is mindset. So learning how our brains work and then figuring out how to take that knowledge and apply it. So learning some elements from coaching, like the model. So your thoughts influence your feelings and your actions, and then that shows, results in the results that you see in your life. That little tool has been critical. Learning the work of Kristen Neff and self-compassion, treating ourselves as we are our own best friend. That's very science-proven technique to really help bring that stress response down. And then really, this is something I continually have to come back to, and I think I will for the entirety of my life, is that it's not the destination. It really is the journey. And just focusing on that moment, feeling my feet on the ground, feeling my bottom in this chair, feeling the sensation of the cool air conditioning on my skin is really, it's really helpful to retrain our brain to get out of that fight or flight response.
I wanted to go back. You mentioned a couple of things. You mentioned white noise, like so sleeping. Mm-hmm. My daughter sleeps with one of those machines. I hear it outside of her room. I'm like, and she says, she swears by it. Obviously, people are buying these machines, right? But how is it? Well, what are your thoughts on those, first of all? Because I'd be afraid to go somewhere else where they don't have that machine. And how am I going to sleep? Most of the time, yes, like 99% of the time I am in my bedroom, but I'm so much into, we don't even have shades, just really working with the daylight. When the sun comes up, I get up, and I don't even use an alarm clock, but having the room dark and then keeping it quiet as best as we can without the need for extras. What are your thoughts on that?
Yeah, no, I think that's great if it works. I think it depends on the household, right? If you have folks that are on the same sleep schedule and you can keep it quiet, you're in a neighborhood where things are quiet. One strategy we learned through parenting our 3 kiddos is there's a portable little version of the sleep or the white noise that we have. So we're able to bring that with us so the kids can still nap, which is really helpful. We just brought that on our trip out to our in-laws this past spring break to help keep the kids as best on schedule. It's a 3-hour time change, so that's always a challenge. The one thing I did realize, I had an incredible opportunity to go on a women physician type retreat earlier this year, and it was in the jungles of Costa Rica. And the space I was sleeping in was essentially a bungalow where the front wall was all screen. It didn't have like a wall, and it was really loud.
With all the animals
so I think
at nighttime.
Yeah, so and all the cicadas, yeah. And so I think that kind of had me rethinking. Was it really quiet everywhere where we were as humans? Kind of hundreds of years ago. Maybe in some places, and maybe depending on the time of the year. But that was something that just really had me like, maybe the white noise isn't so bad.
I went to medical school in downstate, SUNY Brooklyn, and it was a bad area. There were ambulances all the time, right? all the time going off. And I remember my first day there and I going to sleep, like laying in bed and be like, how am I ever going to sleep? But you get used to it, right? You
Yeah.
get used to your environment and what's the norm. So for the people living in Costa Rica, hearing the cicadas, or even around here, the cicadas are everywhere.
Yeah.
The other thing you mentioned was dysautonomia. Could you explain that
Yeah.
for the people out there
Yeah.
listening?
So dysautonomia is an umbrella term. It's used to describe when our automatic part of our nervous system, our autonomic nervous system, isn't working correctly. And so, this can then result in symptoms related to any of those parts of our nervous system that we don't ever have to consciously think about. Our heart rate, our blood pressure, those, adjustments of those as we change position. It's one of the main ways that we hear and see about. For me, thinking back in my kind of story, I always had trouble in the OR, in particular in those cases where the OR was kept nice and warm. So deliveries or the pediatric cases where the room was quite hot. And so it was that combination of standing for long periods of time and getting overheated that I thought I was going to pass out, thankfully. And I'm sure my attendings were very pleased that I didn't, but I always had to scrub out. And in hindsight, I realized it was related to having some orthostatic hypotension. So standing too long makes my blood pressure drop and makes me want to sit down. For other people, it can result in trouble with motility in the gut, difficulty with sweating and temperature regulation. And we've seen a lot of these problems, not only in things like Sjogren's disease, but also with long COVID. And we're just starting to learn more about them. And part of it is the science of studying them is really hard. And so it's hard to know how to treat something when you don't exactly know what's driving that process.
My husband operates with a woman, she's a plastic surgeon. She operates with an ice vest underneath her scrub.
Yes.
So the ice is constantly flowing or the coolness, and she has to step on something that has ice on it as well. We need the operating room light, but for those who haven't been in the operating room before, it's very hot because those lights are huge and it's beaming down on you. So I was having trouble with the changes in life, let alone something like this with, you're
Yeah.
more prone to developing those hot flashes or changes in blood pressure and whatnot.
Yeah, it's been
Kara,
many years since I've been in there.
tell us about how people can get a hold of you, what you offer. I know you do some courses on autoimmune disease. Tell us about your own professional life.
Yeah, so I clinically see patients 3 days a week at the Ohio State University. There, I see patients both who are on this diagnostic odyssey, trying to be that detective and help them, really understand what's going on and help their symptoms. And also do some really cool things with immunotherapy, so lymph node-based immunotherapy. And then also have my Crunchy Allergist LLC, where I have the Becoming Immune Confident podcast, have coaching and coach courses as well, and do some speaking and consulting. But through that, we really focus on how we can harness healing through our habits. So through nutrition, movement, mindfulness, mandatory me time, and movement, all of these things that are really critical, but really hard to actually make those sustainable changes. And so that's what sets us apart. We're all in it for the long term, not kind of this quick fix scenario.
Kara, thank you so much for being here today.
Thank you so much for having me.
Make sure you ladies check the show notes. There'll be links to Kara on her social media, her website, some of her courses. Thank you again.
Thanks so much, Sharon. This has been lovely.